Namaste and welcome to the next episode of Clinical Ayurveda. Myself, Dr. Mayuresh Agte. We have traveled a long journey with Dipan and Pachan Karma. Hope you have understood and you have liked the aspects we discussed on the background of Dipan and Pachan Karma. We will move towards now next karma, and it is the Vrishya Karma. Obviously, the Vrishya term is in regarding Shukra Dhatu. So, let us discuss which aspect are to be considered when Vrishya Karma is expected in the patient. Now, the first and obvious aspect is regarding Shukra Dhatu, and when Vrishya Karma is considered, we have to think about the three main aspects of Shukra. The first common aspect is Shukra Vardhana Karma is expected. So, by the rule, Vruddhis Samane Sarvesham, Shukra Guna Saman Chikitsa is expected. So, Madhur, Shita, Snigdha, all these properties come in action when Shukra Vardhana Karma is to be performed. The second is Shukra Vruddhikara, Shukra Strutikara is another aspect. It means when quantity of Shukra Dhatu is in well amount, but there is problem in the Shukra Struti ejaculation. So next is Shukra Struti Karma, and third one is both, which will increase the Shukra Dhatu and as well as it will help the ejaculation procedure. So when Vrishya Karma is there, the dravyas like Shatavari, Ashwagandha, Ghruta, Dugdha, which are Shukra Saman, are expected, as well as for Shukra Strutikara, you can use Masha and Falagruta like dravya which help the Shukra Strutikara karma. And both these dravyas, so simultaneously will do Shukra Vardhan as well as Shukra Struti Karma. So when Vrishya Karma is expected, the first line of treatment Shukra Saman Gundharma, Shukra Vruddhikara Gundharma and Shukra Strutikara action is the, so all these three come as the first line of treatment in the Vrishya Karma. Another aspect which is also important, that Shukra Shodhana. When there is some Shukra Dushti, then you have to consider the dravyas which will purify the impurities of Shukra Dhatu. In specifically when there is diseases like Firanga Upadamsha, you have to think of the Shukra Shuddhikara dravyas also. So Katfalo is there, Gandhakasayan, Chopchini, all of these dravyas are to be considered when there is Shukra Shodhan the karma is expected. The another very important aspect about the Vrishya Karma, and if I say that the many pharma products which are mainly designed for the vigor of the patient are almost all of them are focused on this aspect. We have seen Shukra Strutikara, Shukra Vruddhikara, okay, we have seen Shukra Shodhana. Now this is the another aspect which is very commonly needed to the patient. Patient, if a person, almost about 90% of the people will tell you that this complaint. And what is that? The foremost wanted karma in patient, other than Shukra Sruti Vruddhi Kara, is Shukra Stambhana, early ejaculation. And people complain this factor very commonly in your practice. That's why in Vrishya Karma you have to add Janana Vruddhi Kara Sruti Kara at the same time Shukra Stambhana, so premature ejaculation is prevented. So in this case you can use the dravyas like Jati Phala. As I said, if you see the advertisement of the pharma companies which have products on the bagger, they almost all of them will mention this particular factor, that it will increase your stamina during the Vrishya Karma. So, along with Shukra Janana, Shukra Stambhana is equally important in clinical practice. There are many other factors about Vrishya Karma which are not directly related to the Shukra Dhatu as such, some of them, but they are also important in our clinical practice. We will discuss them in the next episode. Thank you very much.